Hi, just coming back for an update. One of the things that I want to get out of the way in the beginning is that um, get your colonoscopies in your 40s. Your doctor won't tell you to do it. This is up to you. We're not looking at preventative cancer. The Cancer Society would be, doing national campaigns, but the cancer sector is now a business sector, and we've now become customers instead of patients. So it really doesn't help them if they can't treat the tumor. So a tumor takes 10 to 15 years to grow to just 1 centimeter. Mine's 4 centimeters. Not anymore. I'm sure that it's come down since I've done the radiation, and I'm on I've done 4 rounds of 6 on my chemotherapy drug pump. I'll talk about that in a minute. But the most important thing I want to talk about is if anybody in your family has had polyps removed, then you need to tell your kids to check in their 20s. There's currently a case right now. My nurse is treating a 22-year-old child with rectal cancer. So it's sad to see in these young kids, and I really blame it on our environment. We haven't seen cancer like this in the early 20s and 30s, but as soon as the tobacco industry sent all their scientists over to the food industry to develop their food additives and their addictive products that they're putting into their products, all of these numbers on the back of your ingredients is causing a lot of the disease in our society today. So stay away from processed foods, highly processed foods. Treat them as party food. When you go to a party, have that kind of crap in your body, but don't have it daily or weekly. Stay away from alcohol if you can. Treat that as social. Don't buy it in the home and drink it every day. Don't become that cultural person. You can have kombucha, which is really a nice drink to have that will help you kind of curtail the habitual desire to have a beer after work or a wine. But just do it socially outside of the house. Go out once a week with your friends and have a drink. Don't do it daily. That causes cancer. But basically, just take care of yourself better. This is preventative on your end, and get your colonoscopies early. This is preventative on your end. Your doctor will not encourage you to do this, and he doesn't have to. It's not in his best interest to, and he's going to protect that industry's income. So I think it's important that you hear that first. As far as I'm going, like I said, the radiation was the worst part that I've gone through. But this chemo is not a walk in the park. It's the first week when I'm on the pump and taking it home, I'm on the PIC line, the Folfox drug. It causes a lot of fatigue and insomnia, and then it causes a lot of acid coming out through waste. I think that that's probably the most uncomfortable part for me. So I'm still using the Instagel, and I'm still using the Ultra Prox suppositories, and they help. And then I'm only taking ibuprofen once a day if I need it. Sometimes I skip several days without having it, so I'm off the medicine, pain medicine. So that's good. I did manage to go to camp this year. I go to camp every year. Sleep in a tent on the ground, powered site, top 10 facilities. So, there are some comforts there. That was kind of, hard for me to do. I slept a lot and took care of myself. But I did it and I enjoyed it. So I got through that. So I'm still doing work from home on the second week after my chemo injection. So the first week I'm just not doing it, and thankfully I work from home, so I can kind of pick and choose my hours. Very, very wonderful company that I work for. Harcourt's is a fantastic company here in Papamoa, so it's fantastic. So they're very good. Other than that, that's it. Just want to let you know that if anyone's been diagnosed with rectal cancer. I'm stage 3, or probably not at stage 3 anymore, because I'm on a tail end of my my treatment. I am drinking the methylene blue every day. I haven't gone far beyond that. The soursop tea I drink every day. Just eating whole foods, making my own bread, staying away from preservatives. Bread's only 4 ingredients, and it shouldn't last more than 1 day anyway, so make your own bread. It takes 10 minutes to prepare, and then you just let it proof a few times and throw it in the oven in an iron skillet. If you want the recipe, go on my Instagram, Ola Jules. Yeah, that's it for the updates. Take care of yourself. Go through the other videos. If this is the first video you've seen and you've just been diagnosed, there's some self-care that I talk about which help me prevent any of the skin issues that come along with radiation. Doctors were quite surprised, and they wrote down my bath recipe, so that was really helpful for me. But anything else, just ask me, and I'll update you. Again, I have a healing coming up at the end of this week. That will talk about that. I'm going through the quantum hypnosis healing therapy in early February. I've never done that before. I'm looking forward to that. I've been following the Dolores education since 2016, so I'm quite open to that. It's just that this is the first time I'm actually taking advantage of some of the practitioners in my area. So I'll update you on that and tell you how that went. So talk again soon.